my water just broke. I felt like things really intensified.
She was right there and she was coming.
It was an amazing feeling.
I'm going to cry just thinking about it. I could feel her head.
We heard her cry. We were squeezing hands and she was screaming.
I'm Bryn Hunt Palmer, and you're listening to The Birth Hour. This podcast is designed as a safe place to come together and share childbirth stories. Stick around and join us to hear informative and empowering birth journeys from all over the world. If you're new to the Birth Hour, you may not know that we have an online childbirth course that is evidence-based. It includes 12 modules that take you from your final weeks of pregnancy through obviously preparing for birth and then postpartum and feeding your baby as well. And with enrollment in that course, which is called Know Your Options, you'll get free access to our other course called Beyond the First Latch, where we talk all about pumping, feeding baby, storing milk, going back to paid work if that's part of your plan, all of those things as well. Okay, so if you go to thebirthhour.com/course, you can see everything laid out in the course, module by module, as well as an FAQ section, which will hopefully answer some of your questions if you have any, things like how to get it covered by an FSA account and things like that. It also talks about the bonuses that come with the course, including bi-monthly Zoom calls and access to our private Facebook group. So again, that's thebirthhour.com/course. And you can use the coupon code 100OFF for $100 off enrollment as a podcast listener. We would also love to welcome you into our listener supporter group via Patreon. That's at patreon.com/birthhour. And by becoming a Patreon supporter, you get access to all of our archived episodes. This podcast launched in 2015, so we have over 800 episodes in the archives that are not in the main podcast feed, so you can get your fill of birth stories. And you'll also get access to our private Facebook group for Patreon members, which is a great place to honestly just to search the past posts to get answers to questions, but then of course to ask new questions, find community. It's a really, really great supportive group of people. So I highly recommend joining that. We would love to have you there. We also do monthly Zoom calls with our Patreon supporters, and you get an opportunity to enter your birth story via a different submission form than everyone else uses, and we choose 2 Patreon members each month to share their birth stories. So that is again at patreon.com/birthhour. Today's birth story guest is Anna, and she has 3 stories to share. They were all hospital births in Atlanta, and she talks about how different they were and how she really looked for something different when it came time for her third. Today's episode is brought to you by Air Doctor. Americans spend an average of 90% of their time indoors, but did you know that indoor air can be up to 100 times more polluted than outdoor air? You can breathe easy with Air Doctor, the award-winning air purifier that eliminates 99.99% of dangerous contaminants like allergens, viruses, smoke, gases, mold spores, and more. Air Doctor was voted Best Air Purifier by Newsweek, so it's no surprise that 98% of Air Doctor customers agree their home's air feels cleaner, safer, and healthier. Unlike other purifiers, Air Doctor captures invisible particles 100 times smaller than standard HEPA filters. We have air purifiers in our bedroom as well as the kids' bedrooms, and everyone has been sleeping better. I love how quiet the Air Doctor is. It's like the perfect amount of white noise. I would absolutely splurge on this for a nursery for baby. Like, get the cheap crib from IKEA and put your money towards this so that your baby has clean air in their nursery. We also have one in our living room, and I've noticed a huge difference after cooking and things like that. It just really clears the room really quickly. Head to airdoctorpro.com and use the promo code BIRTHHOUR to get up to $300 off today. Air Doctor comes with a 30-day money-back guarantee plus a 3-year warranty, which is an $84 value for free. You can get this exclusive podcast-only offer now at airdoctorpro.com, airdoctorpro.com, using the promo code BIRTHHOUR. Hi, Anna. Welcome to the Birth Hour. Thank you so much for being on the podcast.
Thank you for inviting me, Brina. I'm very excited to be here.
Awesome. Well, I know we have a lot to get to today, but before we do that, can you give listeners just a little bit of information about you and your family?
Sure. My name is Anna. I live in Marietta, Georgia, with my husband and 3 kids. Alexander, who is 9, Theodore is about to turn 6, and Constantine is 9 months old.
Okay, and we're going to get all 3 stories in today. So why don't you go ahead and start us off with your journey to getting pregnant with your first?
Sure. I started trying to get pregnant in my early 20s, shortly after I got married. And it took us about a year of trying naturally before we figured out that something wasn't going well. So I've done all the workup. My husband done all the workup. Nothing showed up on medical stuff. And my doctor advised trying Clomid and later letrozole, the medication that helps to ovulate. So probably about 2.5 years after in our journey trying to conceive, we end up in the fertility clinic here in Atlanta in one of the biggest hospitals. And I wanted to share that experience with the audience, hoping that it may help someone. So I am a runner, and I've been a runner for a very long time. And I share that because it's important in this conversation. I am rather on a lean side. So when I went to that clinic at the very first meeting before any test results were shared by the doctor, she told me that I'm too skinny, although my BMI always was in the normal range. And she won't even talk to me before I gain 15 pounds. So that journey happened.
Wow. Yeah, I haven't heard that before.
It was difficult. You go to Dr. Google and you start looking through the stories and it gets to your head. And so I hang my running shoes and already feeling that I'm failing, getting pregnant. And now I really have to give up something that I love doing. It was messing with my head quite a bit. But
yeah, I bet.
I was able to gain maybe 10 pounds. And so went back to the clinic. Now they run the test result, blood work. And we landed on trying IUI cycles. I think it's intrauterine inseminations. We went through 3 cycles. And every time I would give myself a shots of hormones to stimulate ovulation. They would test with the ultrasound to make sure I was about to ovulate and then perform the procedure. And every time the procedure was scheduled on day 14. And I'm sharing that again. It will come up later in my story. But all 3 cycles left. And because of the difficult relationship with the doctor, because I constantly felt that I was failing, I didn't feel that clinic was the right place for me, and I searched for another place. We transfer our care to a different doctor who in the first meeting said, well, it would be wrong to continue doing the same procedure and expect different results. So we agreed that we're going to go with IVF. We scheduled the start of the cycle, but decided to take a month off. And so, as I heard many times on your podcast, we went away during that month off for vacation, and I came back home pregnant. What was interesting for me is that I didn't expect that I will ovulate. We were on vacation during days 19 to 20 something of my cycle. And that will repeat later. I ovulate later than expected. It's always day 19, 20. I just don't understand how the first clinic didn't catch it.
Yeah.
Even with the ultrasound. But once I was pregnant, my pregnancy progressed normal. I was quite sick and nauseous to the point where I losing weight during my first trimester. I think first time I lost about 10 pounds, but that wasn't alarming to my doctors. So we proceed as normal. I spent the first trimester, first 12 weeks with my fertility clinic, which was quite interesting and intense. They tested my blood every 2 days for the first couple of weeks just to make sure that the hormone levels were rising and doubling as expected. And then I think by the time I was released from that clinic, I had 4 or 5 ultrasounds, which is a lot for 12 weeks. But everything looked normal. I wanted to share one tip because my nausea was very severe, and the only thing that was helping, and I haven't heard it anywhere else, was hibiscus tea. That's the only thing that I could take down and keep down for quite a few weeks, and sometimes it would help me to drink that first and then be able to eat something. So hopefully somebody can use that advice.
Yeah, a good tip.
I went back to my OB and I was planning for an unmedicated birth, quite frankly, because at this point I was distrustful of medical system and I thought that my body probably knows better.
Okay, so what did you do as far as preparing for birth?
I have taken hospital classes, everything that they were offering. And I think at that point, I already watched Business of Being Born.
Okay.
But that's probably about it.
All right. And then anything else you want to share from pregnancy, or do you want to go ahead and talk about how labor started?
I'm going to go in and share the labor.
Okay, great.
Getting closer to the end of the pregnancy, my doctors knew that I was planning for unmedicated birth. So I was very surprised and upset when at 39 weeks, my OB said that we need to go ahead and schedule an induction without being able to explain or give me any reason for why. I pushed back on that first visit. She wanted me to come back at 39 and a half weeks. Again, the conversation about an induction and asked to do stretch and sweep, which I agreed to, which that sweep didn't do anything. But it's already put me in a sense of being quite upset. And then on my due date, I remember going for, I wouldn't call it a run at that time. I was power walking probably. And thinking about being failure for the first time. I cannot get this baby out. I'm going to have to go to an induction in a couple of days here, get my emotions out. I came back home. And as soon as I got home, the contraction started. So I felt that emotion release, crying it out. That's what put me over the edge. It was around 10:30 in the morning when I realized that contractions were consistent. They lasted about 40, maybe seconds at that time, every 7 to 10 minutes. And as they progressed, they got more consistent and stronger. I stayed home as long as I could, but about somewhere around 3:30, we've decided to go to hospital. And by the time we arrived, I was already 7 centimeters dilated. So I was very excited. I was making it. The unmedicated birth was going to happen for me. That's how I felt. But when I arrived to the hospital, I started playing a good patient. I got the robe and was asked to get in the bed. And the hospital that I went to is called the Baby Factory in Atlanta. There are a lot of babies being born there, and there are a lot of procedures in place. And what was interesting to me is when my nurse told me that this is first time she's seen unmedicated birth. That was, the first little bell that I felt unsafe.
Yeah, that's crazy with how many births they see every day.
Yeah. So I got into a transition shortly after I got to the hospital, and my brain went to a different place. I wasn't being able to advocate for myself anymore. So my nurses were telling me to stay in the bed and not to move. And in fact, during one of more intense contractions, I just started getting out of the bed because I was so uncomfortable and I had so much back labor, and the nurse just pushed me back and said, I have to stay in the bed. And then shortly after that, I requested a pain relief medication. It was definitely too late for epidural, so all they could offer me was an IV meds. But right as nurse was going to give me those medication, the doctor, the OB on call, who I've never met before, came in and he said, wait until contraction is over. And he asked me, he said, if you get the medication right now, the baby will be born sleepy. Are you sure you want it? And between contractions, I was able to say, no, I don't want that. So at that time, he asked if he can break my water to speed the process up. I consented to that. And shortly after that, within minutes, I was ready to push. And I was pushing for quite some time. I think at least 2.5 hours, maybe a little longer than that. But I wasn't making a lot of progress. And at some point, that same doctor came back in and said, I am making a small cut here. He didn't ask. So he cut an episiotomy, and a second later, the baby was born. I was shocked. I remember not understanding what just happened.
Yeah.
I was asking everybody, what just happened? What happened? And then I saw a baby. And that he didn't cry right away. And I remember saying, cry, baby, cry. And when he did, I did get that immediate sense of love. So everything else that was happening, it wasn't mattering in the moment.
Okay.
Unfortunately, after episiotomy, I tore farther, and I had a 4th-degree tear that required pretty significant repair. I think it maybe took about an hour and a half. And then after the repair, they couldn't release me until I would pee, and I couldn't. So it was a catheter involved. It was too many medical interventions that I didn't want. But what was probably the most difficult for me is that when everything was finally said and done, and I was allowed to move to postpartum floor, this hospital had a policy in place that mom cannot hold the baby. And that has pushed the little bed that they have with the baby behind mom. And we got separated. I got into one elevator, and my husband with the baby got into another elevator. And that actually caused me a panic attack. I could not comprehend what was happening. So luckily it was short-lived.
Yeah.
So it was a journey.
Yeah. All right. Well, I'm assuming maybe you changed things up with your second.
For sure. For sure.
Okay.
So on the positive side, my firstborn was an awesome nurser. He was like a baby shark. He would just latch and get all the milk in like 5 minutes. He was amazing. He didn't take to the bottle though. So when I went back to work, we went to a reverse schedule. That meant that I nursed at night a lot. And then during day, it was like spoon feeding kind of situation. And that lasted until he was 2.5 years old, when I decided that it's time to try for another baby. So we had to night wean him for me to get the cycles back. But now that I had a clue that I might be ovulating later and I start testing, we were able to get pregnant in 2 or 3 cycles. So it went much faster.
Yeah.
My pregnancy with the second baby was very similar, a lot of nausea, lost quite a bit of weight in my first trimester, but nothing else that is out of ordinary. But I did make some changes in my care. I went with a group of midwives that was practicing in a hospital. And initially, I was very happy with the care. The appointments were longer. It seemed like they were trying to get to know me. And I was happy to continue care with them all the way up until my 20-week appointment, the ultrasound appointment. They didn't have the ultrasound technician in their practice. They didn't have the right person, so they sent me to MFM instead.
Oh.
And so I was getting my 20-week appointment there, and it lasted quite some time. And the technician wasn't very talkative. She didn't answer any question. And then after she completed all the measurements, she just left and said, "Wait a minute, I will be back." Which was, already puts you on alert.
Yeah.
And she actually didn't come back. The doctor came back. The MFM, so high-risk OB, came back and said that something was wrong with my placenta. They diagnosed me with complete placenta previa. And I didn't know what that meant at the time. So I asked, well, what does it mean? And she said, well, it just means that you can't give birth vaginally. We're going to schedule you for a C-section at 39 weeks. And if everything changes, we can revisit that. And that was all the information I was given. So I went back home and I went back to Dr. Google.
Right.
And I've learned everything I could about placenta previa. And that's in fact, if it keeps covering the birth canal, you can give birth vaginally, and a C-section may be a real option, but it also could move during pregnancy, which wasn't mentioned to me during our appointment. So I spent the next couple of days researching how the C-sections are done here in Atlanta, and I found one practitioner who was doing a family-centered C-section, which in his practice meant that the IVs would be placed in a way that mom's hands can be free, and so the baby can be passed to mom as soon as he or she is born. So I scheduled an appointment with this doctor who is very controversial figure here in Atlanta because he practiced shared decision making. And so there were some situations where the decisions that were made were incorrect. So if you ask around, you would always get conflicting opinions about him. But when we had an appointment, he performed the ultrasound, and then he sat down with me and explained it, drew the pictures, and he told me that between the pictures that he had from 20 weeks and now 24 weeks, he already sees that my placenta was moving, and he felt very confident that it won't be a complete previa by the time I reach full term.
Oh, great news.
Yes. And so I went back to him at 28 weeks and we did another ultrasound, and it was confirmed that placenta moved. So now I had a decision to make where I would go, because this doctor, who I appreciated a lot because I do want as much information as possible, he was an hour away from where I live. And I had a 3.5-year-old at home, and it was second birth, and my first wasn't that long. So we started looking for different hospital. We hired doulas at around that time who help us to navigate the system. And we ultimately decided to go with the midwifery group that delivered at the hospital 10 minutes away from where I live.
Awesome. So you jumped around 3 times in pregnancy, but it sounds like you landed at the right place.
Yep. I also was lucky because their cut off for taking patient was at 28 weeks. And so I spent a long time on the phone trying to convince them to take me in, and they agreed.
Good.
So the care there was great. It was a group of 9 midwives who I was meeting with. And again, at that time, compared to the OB care during my pregnancy, I thought it was much better. It was more personal, even though I was meeting different people. They seemed to be more open-minded, asked me about my preferences. I did not want to take the glucose test because I was constantly nauseous, and that test made me so sick in my first pregnancy, and they were open to finger prick testing instead of the glucose tolerance test. So it all went great from that perspective. I was sharing that the 2 goals that I had for my second labor was to avoid severe tearing. Again, I healed fine, but I was very concerned with what my future healing and function can be if I tear severely again. But also I wanted to avoid pushing on my back just because of bad memories and perhaps some trauma of somebody pushing you in labor back to your back. That happened during my first labor.
Okay. And this group sounds like was agreeable to those things.
Yes, they were.
Good.
So at 39 weeks, exactly, early in the morning, around 5-6 p.m., I start feeling my first contractions, and they were pretty consistent about every 5-6 minutes, but they didn't last more than 30 seconds. So I put my doula on alert at that time, and she shared with me that she is already in the hospital, the same hospital I was going to deliver in, because they had another client who was in induction in that hospital. And what was great about my doulas is that they worked in pairs. So that I knew 2 people who they guaranteed one of them would be with me at the time. So I wasn't worried about my doula busy with somebody else. Another interesting thing about that labor is that my contractions were pretty strong as long as I was not near my 3-year-old. As soon as I saw him, they would fade away or stop, to the point where,
oh my gosh,
I would be making breakfast for my son, and it would be 15 minutes, 20 minutes, no contractions. And then I would step inside pantry to pick something else. And this massive minute-long contraction would hit and bring me to my knees. And then I'm going to go see him again, and nothing for next 10, 15 minutes. It was in October, so I have pictures making pumpkin lanterns with him because I thought, well, I'm going to have babies, so this is last time. So around 2:30, 3 p.m., we decided that we just need to take him somewhere else. and my husband took him to his aunt. And as soon as my son was out of the house, the labor just got on track. Every 5 minutes, the contractions were getting more and more intense. I start needing hip squeezes. I was confident that the baby will be born soon. So at that time, I called my midwife and I said that I'm coming, which she said, I don't think so. I saw you yesterday in the office, and she gave me a cervical check a day before, and she couldn't even reach my cervix. So she was like, stay home. I called her back 30 minutes later and said, I got to get to the hospital now, which she tried to convince me to stay home longer, but I just didn't listen. And so we drove to hospital. When we arrived and I got checked, I was 7 centimeters again. Immediately, we were taken from triage to a labor and delivery. And I think my doula only had time to start hanging those twinkle lights when I told her to stop, that I needed her. So she was very helpful, although it's lasted very short. The intensity of labor was so high at that time. And I remember her standing in front of my face and just telling me to breathe it down. And that visual, just breathing the baby down, was incredibly helpful. I spent 13 minutes in the room before the baby was born. So within minutes of us arriving, my midwife came in and she asked me to get on my back. And my doula, Emily, she tried to tell me, Anna, you don't have to do what you don't want. But I was so deep in labor land that I got on my back and I pushed once, and I saw the face of my husband and my midwife. I saw in their face like, don't stop, the baby's almost here. And so I gave it another push and he was born.
So fast.
Very, very fast. Very, very different from my first labor. He was placed immediately on my stomach. Unfortunately, his cord was so short that I couldn't see the baby's face for quite some time.
Oh, wow.
So we waited until placenta was born to cut the cord. And then I finally saw my baby's face.
That's very short.
He was barely reaching my pubic bone, I want to say.
Wow. I guess that placenta was just doing all its work moving versus growing a long cord.
Probably. And I was expecting that same, I was overtaken by emotion and love when I saw my first son. And I was expecting that same reaction, but I didn't experience it. Which was concerning to me in the moment. But I've heard so many stories that you connect to your babies in so many different ways.
Yeah, I was the same with my second.
Yeah, it's just in that moment, it's kind of something is wrong.
Mm-hmm.
And then, Bryn, I was that mom in the hospital that all the nurses said, oh, poor thing, because the baby was just screaming.
Oh, no.
He was screaming and screaming and screaming nonstop. And he screamed the entire time we were in the hospital. And then we got home, he kept screaming. And I had a 3.5-year-old to take care of. And I just couldn't do anything because the only way this baby was settled down was in my hands. And it wasn't really settling down, but it wasn't just yelling on top of his lungs. And, there were a few signs that something wasn't quite right early on. He was probably 5 days old when I was changing his diaper, and I noticed a tiny specks of blood on his butt, not kind of on the skin. And I called the pediatrician and they said, well, it's not a big deal. Infants have different reactions. Don't worry about it. And then a couple of weeks later, I saw a projectile vomiting. And again, well, things happen. Don't worry about it. He was gaining weight great. And later I connected that to the fact that I am an oversupplier and I do have a very forceful letdown. So whether he wanted that milk or not, he was getting it. So that just kept happening for the next couple of months, just a lot of, crying. And I was in doctor appointments or lactation consultant appointments most day of the week, just trying to figure out what was wrong. Finally, we had some answers when it was my sister-in-law baby shower. So there were a lot of women, and I went there with my then newborn son. And one of our friends, my sister-in-law friend, who is pediatric dentist, who said, can I look at his mouth? And I was like, of course. And so she swabbed her finger in his mouth and said, he is incredibly tight. He had all 4 tongue, lip, and cheek ties. And I'm so grateful for that, out of blue interaction, because a couple of days later, my milk just dried up. It was gone.
Weird.
So somehow whatever hormones or something kept the supply going, even though he wasn't an effective sucker. Mm. But then at some point it just stopped. And fortunately, I already had answer why. So I went on to find a pediatric dentist who would do revisions from him. And at the same time, I was doing the power pump routine. So I was feeding him and then pumping for 20 minutes every 2 hours around the clock for 10 days while, getting him ready for the revisions and all of that. And that helped. My milk came back. And I was so hopeful that, all this crying and just unhappy baby, super tense, high muscle tone that will resolve with the revision, which is probably silly, but at the time when you're so hopeful. So it definitely helped, but he still was very, very unhappy, constantly crying baby. And maybe a week after the revision, I saw a blood in his diaper for the first time. Mm. I called pediatrician and she returned my call and said, this is sign of MSPI, milk soy protein intolerance. So as soon as she mentioned that, I went off any dairy and soy, and within a week, I had a happy child.
Oh my gosh. Wow.
He just turned around. He became smiling. He was almost 3 months at that time. He became smiling and happy and engaging, and he didn't cry, and he didn't need to be held all the time. And I just wished that somebody, one of those doctors that I've visited, told me that that would be a possibility.
Right. And so your milk supply came back?
Yes. And in fact, I think that 10 days that I did it, I've overdone it for sure. I should have stopped sooner because I was an oversupplier to begin with. But when the milk came back and I kept doing it because I was a little too scared.
Right.
I kept producing, and it was hard to be an oversupplier, but I think I'm also grateful for it because now that I was dairy and soy free, I kept pumping and I gave away that milk for the babies with special needs who also couldn't take dairy and soy for probably a year and a half.
Nice.
So that was a benefit.
Mm-hmm. Yeah, that's so hard, especially with your second baby, because you kind of feel like you've got this thing figured out a little bit, and then they just throw in this thing you've never heard of. That
for sure, it's like you go into it and you think, I know everything, and then they teach us humility, right?
Yep.
And it might be a little triggering for some, but unfortunately, my baby got better around 3 months. And when he was 5 months old, his dad was diagnosed with terminal cancer.
Oh my gosh.
And passed away when Theodore was 11 months.
Oh, I'm so sorry.
So that first year was really rough.
Yeah.
So that takes me to my third story.
Okay.
I met my now husband later on and we got married, and I went into it firmly knowing that I'm done. But my husband, he always wanted to be a dad, and he was saying that he is grateful for the opportunity to be a father figure for my older boys. But it was very clear that he wants to have one of his own. And at some point, I decided that I'm going to give it 6 months before we take a permanent measure.
Okay.
And so we got pregnant on third try.
Okay.
And I also wanted to share, as we said, how we connect to our babies is very different. My first reaction when I saw that positive pregnancy test was, oh crap.
Mm-hmm.
I was secretly hoping that 6 months is not enough once you pass 35.
Yeah.
But nevertheless, we got pregnant, and my typical symptoms of nausea return. Although this time, in addition to just being nauseous, I experienced this symptom that I only heard once, I think on your podcast maybe, where I was just constantly producing this insane amounts of saliva. And so that just made nausea so much worse. By the time I was 12 weeks pregnant, I lost 15 pounds, and I was going to get IV hydration every few days just to make sure I could function. So I could not keep anything down. But my midwives were not that concerned with it. I kept, my care with the group of midwives that I originally gave birth to my second child with. And by the time I was 16 weeks, I finally was feeling better and able to, get some food down and started gaining weight. As much as I wasn't necessarily excited about being pregnant, I was excited about feeling empowered in my birth and really knowing that I've done it. I gave birth to this baby and somebody didn't deliver him. And it was very important to me. So I started considering home birth and went on interviewing home birth midwives. When I first shared that with the midwife in my practice, she told me, well, first, don't tell me that because I shouldn't know about it. Second, if you're going to do that, look for CNM, Certified Nurse Midwife. And also, have you talked to Carson? And that name would keep coming back to me multiple times. So I've started searching for CNMs in our area. There aren't many. In fact, I only found one, and I got in touch with her. We started talking, and I asked her how she felt about the fact that I've already lost so much weight. And she told me that with my build, unless I gain 45 pounds, she does not feel comfortable taking me on as a client, which I thought was inappropriate at best. She also told me that she's not into this fit mama thing.
The what?
It's a quote. I am not into this fit mama thing. You need to gain weight.
Fit. Oh, okay. Interesting. That's an interesting comment.
Yeah. So that interview didn't go anywhere. I've interviewed a couple more, and I finally found a person that I really felt comfortable with. And when we start talking about, it was important to me to understand what would happen if there are complications. And this midwife recommended that I talk to Carson again, because Carson is a midwife who delivers in the hospital, who backs home birth midwife. And it was around that same time I heard an episode on your podcast from a woman in Atlanta who shared her story of, I believe, home birth, but also having a backup midwife who already knew her and was prepared to deliver in the hospital if that was necessary. Mm-hmm. So I got curious, and I found out who that person was. Her name is Carson Reagan. She has a practice called OB2Me, and it's a concierge practice. So I interviewed her, and I really like her, and I went to her practice. And Breen, I wish that's how everybody practice care for pregnant women. It was her and her partner midwife. All of my appointment lasted about an hour. Mm-hmm. Unless one of them was catching a baby, they both were there. They got to know me. They got to know my husband. They saw my children. They really listened. When I was saying I'm not feeling good, it wasn't, hey, you're pregnant, deal with it. Let's look into it. Is it your iron level? Is it your vitamin B? Is it something else? So it was just day and night. So I was very, very happy with that. And also around that time when I was pregnant, it was the third baby for me, but it was first for my husband. And it was very important for me that he understands the things that are important to me so that he can advocate for me in the moment. And what we've done, and it worked fantastic for us, we sign up for Know Your Options birth course, but he took it without me.
Oh, I love it. Like, you wanted this baby, you got to learn.
Yeah. And it worked fantastic because, I listened to the courses, but I've been there, done that, right?
Yeah. And it sounds like you've listened to like all the birth hour episodes.
100%. I know them all. And our learning styles are so different. My husband would take notes. He would listen to an episode and stop and take note and go research a term and then go back.
I love it.
So he'd done that. And he was prepared for all of our appointments to ask questions. And it was fantastic.
Yeah, that's really sweet.
So my labor started a little different this time. I started having contractions at 35 weeks. And they were enough for me to, sometimes stop me in my tracks. I remember texting my friend who had 2 preemie babies, asking her about, practices and hospital and what would happen. And it just kept happening. And around 39 weeks, I decided to stop work because by then I wasn't sure what's happening, if I'm going to give birth today, tomorrow, or weeks from now. So at 39 weeks, I stopped working and I went full on into helping this baby to come. I've done acupuncture. I was pumping, evening primrose oil, dates, mile circuits, anything and everything. Curb walking. I would get contractions every morning. They would go on for a couple of hours. If I was moving, they were intense. If I would stop moving, they would become less intense. And then eventually, at some point during the day, they would fade away. And that just kept happening. I remember at 42, I asked my midwife for stretch and sweep, which she agreed to, but she didn't want to do an intense because I like a really good stretch and sweep because I was GBS positive. And so we were concerned about introducing the infection. So that takes me up to my birth story.
Okay, I can't wait to hear it.
So at 40 and 4, I decided to take one last chance at acupuncture. But I wasn't, when I went there, I told my acupuncture therapist, I don't care when this baby comes. I just want a good nap. And so that's what happened. She put me asleep and I slept for a good 90 minutes. I woke up feeling very, very refreshed, which didn't happen a lot. When you're 40 and 4 pregnant, you have 2 younger children and you've been in prodromal labor 4 months by that time. And I woke up and I remember just all of a sudden feeling in love with this baby. And I lie there on the table and I told him that it's safe to come now and I will take care of him. And after that appointment, my doula, Emily, asked if I wanted to talk. So I called Emily and she suggested that I do a mile circuit again after this acupuncture appointment, but instead of just do the traditional miles circuit, I started with the more intense inversion. And so I went home, and I want to mention here that during all this time, all this prodromal labor, I just kept telling my midwife something is wrong with his position. So I went home and I climbed on a high chair and I went into, I want to say, head down completely inversion. And then I did the mile circuit, went on a walk with my husband, and contractions just started. And they never went away. We went on to pick our kids from schools. It was around 3 p.m. by that time. And just, I wasn't timing contraction and I wasn't really even telling anybody, my husband, about it. They just kept coming and coming and coming. And, we went to have dinner with boys. And at some point, my husband said, I can see that they're not going away. And we decided to call their boy's nanny and ask her to take boys overnight. She came in around 7 p.m., pick up the boys. I also called my midwife and I said, I think this is real deal. And we agreed to meet at their office at 9 p.m. And so, over the next couple hours, contractions got more and more intense. We got in a car. We drove to the midwife's office. And it was, it's 9 p.m. now. It's October. It's super dark outside. My midwife opened the office for us. It's dim light. We got into the room and I'm from my previous experience, I was like, all business. So do you need to check me now? And she goes, whenever you're ready. I just didn't felt that, her time is precious and I need to be complying with some rules and timelines. It wasn't like that at all.
Yeah.
So she checked me and I was 5 to 6 centimeters dilated and 90% effaced. And we decided today is the day. And we drove separately to the hospital, which was only 5 minutes away from their office. And because she already checked me in the office, it was direct admission. So we got into the hospital. And this hospital that they deliver in, it's tiny. It only have 6 labor and delivery rooms. And it feels differently. You walk straight to labor and delivery. You don't have to navigate all the labyrinth of hospitals that you often have to. And we got into the room. My doula arrived. When I walked into that room, Julia, my midwife, was already there. And she was hanging the twinkle lights. And I remember walking into the room and thinking, my midwife, my medical provider is hanging the twinkle lights for me. This is going to be different.
Yeah.
The hospital has a rule that you have to be on monitoring for 20 minutes every 4 hours. So that's what we started with. And, another thing is I was GBS positive, but my older children have an autoimmune disease that is connected to alternation in the bacteria in their guts. So I was very, very concerned with doing the prophylaxis with antibiotics during the labor. And we developed this plan that if my water breaks anytime before labor starts, I'm getting antibiotics because the risks are too high. But in my 2 previous births, my water actually never broke on its own. And so we decided that if I'll make it 7 or 8 centimeters without water breaking, we won't do it. And so we just stuck with that plan. So I was free to move. I didn't have any cables or anything. I was moving around and we were left alone largely with my husband, my doula, and I was handling the contractions really well. The only interesting thing was that anytime I was sit down or lay down, they would stop. And so I just kept moving. Later, my doula was sharing that there was no saying, there were no understanding, is this baby going to come today, tomorrow? Just because, the pain was so tolerable and I was doing fine. I was using BirthCom and TENS unit and I didn't really need any other, support from my husband or my doula. They were just kind of there to assure me that everything was fine. And that takes me till about 12:30 p.m. when I asked Julia, my midwife, to check me again. And she did, and she looked at me and said, Anna, you ate. You're doing it. And then she said that the water was still intact, and she thought that as soon as water will break, it will move fast. And so, I got up, I start moving again, and the contractions start getting a lot more intense. And I remember after one of those contractions, I looked around knowing that the next one is coming and my husband wasn't there. And I started panicking. And my midwife stepped in because at that point, I needed hip squeezes. And I was so impressed that this tiny woman has so much strength in her that she was able to give me those hip squeezes. And then again, there is nobody in the room. It's my husband and my doula. And my water broke during one of those intense contractions. And I remember asking, is it clear? And I think at that point, my doula just called the nurse. I was standing near the bed. They put a towel underneath me, and it was immediately clear that the water was very stained. It was kind of yellow brownish. I could not think about it at that point. After that contraction, I immediately said, a couple more contractions like that, and I wanted Julia to check me again. And I don't know why I said that. There's nothing that Julia could do. But as next contraction hit, I remember yelling, I have to poop. It was just overwhelming that, something was happening in my body. And later, my doula told me that at that point, she gloved up because there were nobody in the room and the baby was coming. But luckily, my midwife ran in and she got behind me and said, Anna, get on the bed. So I got on the bed on my hands and knees. And Bryn, I did not push. All I remember is I just remember from my second birth when Emily, my doula, was telling me, Anna, breathe that baby down. I was just thinking, just go with it. And so on next contraction, the baby's head was born. And I might have yelled an F word because of how intense that was. And, seconds later, he was born. Julia caught him and she immediately said, compound hand holding his cord. So my sense that something was up with his positioning was right all along.
That's so funny. That's
why all those weeks of prodromal labor, because he was just not applying the pressure in the right way. But I turned on my back, I got on the bed, and he was immediately on my chest, and he was tiny. He was so tiny, and he was covered in meconium. The poop was all over me. It was on my face. I remember the midwife cleaning up my face and trying to rub him a little bit. We had a very long delayed cord clamping. I think it was about 20 minutes before we had to cut his cord. And, during that time, all I remember is just laughing and crying and loving this baby all at the same time. But then the baby nurse came in and said, we have to take this baby to the warmer because he's struggling breathing. And so that's when my husband cut the cord and the baby was taken to the warmer. And I told him to go with the baby. The way the room was set up, the warmer was on the side and behind the bed. So I really couldn't see what was going on there. Another thing that I wanted to share here is that 3 weeks before my son was born, my husband's dad passed away from lung cancer. So he was on CPAP, and that's the whole family was there to see him passing away. And so now my baby is in a warmer, struggling to breathe. Mm. And I wasn't sure who I was worried more about, him or the baby or my husband who had to watch that.
Yeah.
So at that time, I asked Julia to move on with the repair, and I had very superficial tear this time that only took a couple of minutes to repair. And as soon as I was done, I said, I need to go to see the baby. And I remember that, I said that, and Julia said, fine, sure. But the nurses weren't moving. And I went, is there something you guys need from me in order for me to walk away? They said, no. I said, well, then help me to dress up. So I dressed up, I stood up, I went to the warmer, and I saw this tiny, tiny baby in the warmer on CPAP with the respiration therapist. And they were putting CPAP and then putting the tube into his nose to suck the liquid out of his lungs. And it was very, very helpless feeling just to stand there and not being able to hold him and to comfort him. But then after probably 15 minutes there, my husband asked, how serious is this? And, what's going to happen next? And they said they're still evaluating. He's likely need to go to NICU. And then they did one more cycle of putting the CPAP on him and sucking the liquid out of his lungs. And then the baby nurse looked at the respiratory therapist and asked, well, can we let mom hold the baby? And what was implied before we take him to NICU? And the therapist said, sure. And so I sat down on this tiny, those tiny chairs that nurses and doctors use to enter the stools to enter their notes. And they finally gave him to me. And as soon as it was just amazing. As soon as he was in my hands, he just recognized me, and he perked up and started crying, and he started rooting. And I remember saying, "Oh, you hungry?" And I just put him on my breast, and he started nursing right away.
Aww.
And the therapist, if he can nurse and he can breathe at the same time, he's fine.
Yeah.
So at that point, my doula, very, very, she inserted herself and said, well, does she have to do it here, or can we take her to the bed? And so everybody said, yes, we can take her to the bed. And a couple minutes after that, I was in the bed with my baby, and I had that safe space. Nobody was right next to me. And he latched, and he stayed on me for next hour and a half. And the respiratory therapist kept coming and checking, and he was fine. He was breathing. And so that was the end of that journey.
Yeah.
And that moment when he latched was just that moment when I absolutely fell in love again.
Yeah, that's amazing.
Yeah.
Oh, I love that. Thank you so much for sharing all of those stories. It was a lot to get in there, but we did it. Do you want to share any resources here at the end?
Yes, I have a couple of things that I wanted to share. So for mamas, especially if it's not your first baby and you experience some of those annoying leaking, I found the Love Steady maternity support bloomers. They say that they engineer to support your pelvic floor. And I was like, nonsense, but I tried it anyway. And oh boy, they do.
All right.
I also wanted to mention the hibiscus flower tea that was so helpful for me to get over the nausea. Maybe if you tried everything, it can help you as well as the Know Your Option birth course. I know everybody has mentioned it, but it's a really good tool for dads as well.
Oh, I loved that story.
And then, two big resources for me were Two Doulas and You are the doulas that supported me in both of my birth, and they supported me postpartum as well. And OB2Me, if you're in Atlanta area and you're looking for that special connection and the person who would really support you and your choices, I really recommend them.
All right. That's a great list. And we'll link to things on the show notes. And then where's the best place for people to connect with you?
I listed my email address. I am not on any social media.
Okay. Sounds good. We'll put that on the show notes as well. Thank you so much for sharing.
Thank you, Bryn.
Thank you so much again to Anna for sharing her birth stories with us, and to Air Doctor for sponsoring this episode. Remember, you can go to airdoctorpro.com and use the code BIRTHHOUR to save there. And if you want to look at today's show notes page, head over to thebirthhour.com and just search for Anna's name in the search bar.
Thanks so much for listening. If you enjoyed today's show, head to thebirthhour.com and click Become a Member to pledge your support. And as a thank you, you'll get an invitation to join our private Facebook group and access to exclusive episodes. Your vote of confidence and support means the world to me.